Hi everyone, and welcome to today's presentation, part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. We're pleased to be offering this webinar series. We'll be offering the webinars on the third Tuesday of the month at 1 p.m. and we'll cover a host of topics that are sure to be of interest. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects, as well as opportunities for collaboration. To give you a sneak preview of a few upcoming webinars, we'll be featuring the work we are currently doing to prevent injuries and keep Alaskans safe during the dark winter months in March of next month. And in March, we'll be discussing the statewide efforts taking place to increase cancer screenings to prevent colorectal cancer. Other ways you can stay connected to our work is through our monthly newsletter. You can sign up for this on the section's website. Our website address is at the bottom of all of our slides. A few housekeeping items before we start. Please mute your phones. Also, please do not put this call on hold. Rather, if you receive a call, please hang up and call back in. The webinar is planned for 30 minutes. 20 minutes of this will be for the presentation, with 10 minutes allowed for question and answer. Before we get started on today's topic, I wanted to give a brief description of the work we do in our section of chronic disease prevention and health promotion. Our vision is for healthy and safe Alaskans, and our mission is to identify and advance the conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease prevention, and data collection and surveillance. The icons you see here represent a few of our programs and projects. A few more housekeeping items about this webinar. Audio for the webinar will come through your computer. If you do not have a speaker that works on your computer, you can call in the number provided here. If you have technical difficulties during the webinar, please let us know by using the questions function in the GoToWebinar control panel. You'll need a microphone on your computer, or you'll need to call in the number provided to ask a question out loud. Please hold questions until the end of the presentation. To ask a question, please raise your hand by clicking on the hand button in the GoToWebinar control panel. And with that, I will let today's speaker introduce herself and her topic for today.
Hello, my name is Nelly Ayala, and I will be talking about helping Alaskans manage diabetes and focusing on self-management programs. Of those, there are two types: the Chronic Disease Self-Management Program, or CDSMP, as well as the Diabetes Self-Management Education Program. So the learning objectives for today's webinar is we're going to learn about the different self-management programs offered by our office. And like I said, that's CDSMP, or also known as Living Well Alaska, and the Diabetes Self-Management Education Program. We're also going to learn how you can implement a self-management program within your community, organization, or clinic, etc. And also how you can be a trained leader in these programs for the Stanford curriculum, which is via an upcoming 4-day training that's starting on February 29th to March 3rd of this year. Before we start, we're going to talk about diabetes in the United States to let you know a little bit about the problem and why these programs are important. The types of diabetes that I'm going to focus on is just going to be type 2 diabetes, adults, as well as access to resources for those who are affected by type 2 diabetes. So as you can see, in the United States, currently 29.1 million people have diabetes. So that's 1 out of every 11 people, and 1 out of 4 do not know they have diabetes. This is information taken from the Center for Disease Control and Prevention infographic from 2015. In regards to type 2 diabetes and what it is, it means that the body cannot use insulin properly, and you can develop it at any age. In most cases, can be prevented. Like I said, we're going to focus on those that are adults, as well as self-management programs. So in regards to the cost, so 1.7 million people 20 years and older were diagnosed with diabetes in 2012. That came to approximately $245 billion in total medical costs and lost work and wages for people with diagnosed diabetes. People who have diabetes are at higher risk for serious health complications. And these are just a few of the many health complications that come up for people who have diabetes. Blindness, kidney failure, heart disease, stroke, and also amputations, loss of toes, feet, or legs. So what are the numbers here in Alaska? These are the numbers regarding to diabetes and prediabetes prevalence for 2014 here in Alaska. As you can see, blue meaning diabetes, red is pre-diabetes rates, and these are all in percentage. So people that are 65 and over, approximately 21.9% are diabetic, prevalence of diabetes, and then 12.7 is there's a prevalence of pre-diabetes. And if we go down, we see a little bit of a decrease as the population gets younger. Also, you can see the differences between men and women, which aren't that much different. Men, the prevalence is 7.4%, and women is 8.2 for diabetes, and for pre-diabetes is 6.5 for men and 10.5 for women. In regards to cost of diabetes in Alaska, like I said, we're focusing on self-management programs. So the annual cost of care for adults in regards to the U.S. population, in 2010, the U.S. Medicaid group, a diabetic would cost $14,229 per diabetic in comparison to a non-diabetic, which is $4,568. It's almost 3 times less. In 2012, for the population as a whole, in average, diabetes costs is approximately $13,741. For non-diabetes, is $5,853. Now, in comparison with the cost in Alaska of Medicaid beneficiaries 20 years and older, we have it broken down by fiscal year. If we were to focus on 2014, as you can see, there's a steady increase on the cost. But for beneficiaries with diabetes, the amount of beneficiaries in 2014 was $6,296. The incurred cost per diabetic beneficiary was $26,310, which is almost double that of diabetic for the U.S. population in 2012. Now, if we were to multiply, if we focus on fiscal year 2014, the number of beneficiaries with diabetes, 6,296, times the incurred cost per diabetic beneficiary, 26,310, and the total cost of diabetic beneficiaries would be close to 166 million. And that's for the Medicaid beneficiaries here in Alaska. So what does that mean, getting all this data? It means that we should focus on prevention programs. We need to make sure to have more programs available to adults, as well as train more leaders and recognize a few programs to make sure the quality of that program is high. As you can see, here's some of the links that exist with type 2 diabetes: inactivity, obesity, smoking, as well as poor nutrition has been shown to be linked with type 2 diabetes. And some of you may be aware about the risk factors for type 2 diabetes, like weight, fat distribution, central adiposity, inactivity, family history, if there increases your risk, race, age, prediabetes. In terms of race, although it is unclear why people of certain races, including Blacks, Hispanics, American Indians, and Asian Americans, are more likely to develop type 2 diabetes than Caucasians are. So what are self-management programs? Self-management programs are programs that are targeting to an audience, mainly adults who have or care for someone with a chronic disease and want to get informed. It's a 6-week program, and I really like this picture because it tells you, like, rediscover your zest for living a healthy life in 6 weeks. So the 6-week program is in a group setting where you meet once a week for approximately 2 to 2.5 hours, and they recommend there be 10 people or more, and they get to learn about new healthy habits and how to adopt those healthy habits, how to create smart goals, and how to maintain those healthy habits for the long term. Also, what is important about the self-management programs is they're evidence-based, they're clinically recommended. The goal of them is mainly to teach individuals the necessary goals to adopt healthy habits. And like I said, the main two types that we're going to discuss here today are the chronic disease self-management program and the diabetes self-management education program. So in order to learn a little bit about chronic disease self-management, I thought it would be good to start by actually hearing from the people themselves. And I'm going to show a YouTube video. And what I want you to focus on is how the program starts, the variety of people in the program, and also what the people think about the program and how they make it easy for themselves to adopt those healthy habits.
Better Living is a workshop for our union members
with chronic conditions
of diabetes.
Diabetes in my family is a big issue.
I have high blood pressure.
My condition is chronic ulcer.
I have high cholesterol.
I have high blood pressure.
I have some high cholesterol warning signs that are going off, and it's something I should be aware of.
In Better Living, members of our union learn how to take care of these conditions through exercise, nutrition, and stress management.
To join in Better Living, I realized that there's other things that I can do to control my blood pressure, as far as eating right, exercising, and using tools that can help me.
You need to have the tools, and Better Living gave you the tool how to help you manage your health.
In Better Living, union members learn to set up their nutrition and exercise goals.
The goals I set in Better Living was to do exercise.
Exercising 30 minutes a day, and just that little time has changed how I feel.
Sometimes I had to push myself, but it was not easy. But once I finished exercising, I felt so good.
Every morning when I go to work.
So the YouTube video is about 7 minutes long, and I thought that this brief a minute would give you a good introduction about what a chronic disease self-management program is. And in California, where this was made, it's known as Better Living. Over here in Alaska, we know it as Living Well Alaska or Better Choices, Better Health. But they're all chronic disease self-management programs. For those of you that are involved with them, as you can tell from the YouTube video, they have the same curriculum, same type of books showing, and plus the class just follows the Stanford curriculum, requires a strong fidelity, so therefore the classes should be similar regardless of the location. The content should remain the same, and we basically see the impact that it does on those clients, seeing how happy they are. So here, in terms of benefits from self-management programs, since we are working within the Department of Public Health, as you can see, it's well recognized by leading experts. There's a lot of information out there recommending this type of program. Long-term behavior, there's been studies done where it shows that people actually, approximately 40% of participants remain and retain those habits and have long-term behavior for over a year. In terms of savings per participant, it's approximately $350 is the cost for one CDSMP class per person, and according to national data, they estimate saving 50 to 70,000 QALYs or quality adjusted life years per participant in the CDSMP class. So why focus on self-management programs? Well, one of the other things, as you can see, it's not only cost effective and you save some money. There's data which shows you, depending on where you implement the program, if you were in a small county, you approximately save $38,803. If you're in a metropolitan city, you approximately save $732,290. And this is making the assumption that you reach approximately 5% of the population within that county or metropolitan city with at least one chronic condition. Also, it uses the chronic care model. When you focus on the community, you provide them with self-management skills, provide them with the right support, and deliver information to them that is important for them to actually communicate better with their healthcare providers and speak the same language in a way as their healthcare providers. So they become an informed and activated patient. Therefore, their self-esteem increases, and they're better advocates for themselves. They're more prepared, they're more proactive, and their outcomes become better. In terms of clinical outcomes now, CDSMP is known to increase health-related quality of life. It fosters the idea of self-efficacy or confidence. It is known to have reduced pain, fatigue, disability, anxiety, depression, and they can also improve self-rated general health. Like I said, it educates patients and provides patients with skills to communicate with the healthcare team. In a way, it also addresses health literacy. People with poor health literacy are known to also succeed in this type of program. So now we're going to move to diabetes self-management education. And the reason why we start with chronic disease self-management is because they follow the same curriculum, like I said, the Stanford curriculum. The chronic disease self-management program has a longer history, and it's the same creators, Kate Lorig, who created the chronic disease self-management program, and now there's a focus on diabetes for the diabetes self-management education program. Now, what is known about the diabetes self-management education program is that it reduces health complications. It can sustain successful long-term self-management. It can also lower hospitalization rates by 34%, and it is noted as a best practice program. In terms of economic savings, if we were to use the numbers from the literature and apply them to the numbers you saw in the previous slides here in Alaska, for each, as we said earlier, for each diabetic Medicaid beneficiary in Alaska, the cost is estimated to be approximately $26,300. So if a person were to attend one DSME class, if all people that had diabetes were to attend approximately one DSME class, then the cost savings here in Alaska would be approximately $6.9 million. Making the assumption that you get $4 and some cents as a return on investment for every $1 spent, then those $6.9 million would become $36 million per year. This is all assuming there's an 100% attendance and everybody just attended one diabetes self-management education class out of the 6 weeks. So how can we help you? Well, our office mainly focuses on providing technical assistance, and what that means is helping with implementation of the program, forming part of our state license, helping you receive training, like I said, the leader training that will be available on February 29th. And if you visit our website, you'll get more information regarding training and other programs available. Also, help with trainings and webinars in the future, like what are you interested in? Here's another tool that we have available for CDSMP, and here's some brief information about what it is. We call it the cost estimator tool. The parts that are gray are parts that you would put in information if your organization would like. And it basically provides you a brief estimate of how much the cost savings would be if you were to implement this type of class in your organization. More information about the tool and what it does. In terms of the multi-site recognition license, a lot of people ask us what the responsibilities would be. So SOA stands for the state of Alaska, and that's basically what my office would do. We are the ones that submit the information to the American Diabetes Association. We are responsible for holding advisory group meetings, putting in the data and all of the application to the American Diabetes Association, training on Chronicle if you need it, as well as providing opportunities for continuing education regarding diabetes. In terms of the site, responsible for conducting and scheduling the DSME classes, entering the patient data, and determining the cost of DSME for patients. It can be free or not, depending on what you guys would like. So here's also updated information regarding reimbursement. For Medicare, we have the Chronic Care Management Service, which now provided information regarding reimbursement, and CDSMP and DSME are reimbursed through Medicare. We also have availability of resources on our website. So this is what our website looks like, and as you can tell, you can see on the left-hand side there's prevention and management programs highlighted, and then here's a list of the prevention and management programs. And if you look towards the center, there's something that says more programs throughout Alaska. So if you were to click on that, then a map would come up and you would see all the different types of programs that we have available through the state of Alaska. You can zoom in on the map, or you can go to the legend and ask for the CDSMP ones to be highlighted, or depending on which type of program you're looking for. In summary, so self-management programs, as you can tell, are needed. 1 out of 3 people in the United States will have diabetes within their lifetime. And one of the things that that I would like to leave with you is a quote from one of the people who participated in a CDSMP class in Ketchikan, which is, "I thoroughly enjoyed participating in this course and came away with a treasure trove of useful information that will serve me in the future." Here's some pictures of our trained leaders. So here's Leslie Shawcross and Linda Shepard. They actually are the ones who came had the class. And here are some of our leaders that were done, which was done in September of 2015. And like I said, we have another class on February of 2016. We trained other leaders, but these are the only people that actually wanted their pictures taken. And here are some resources for you. And more information about the leader training can be found here at the bottom as well. Thank you.
Thank you very much, Nellie. So that was the main part of the presentation. That was the presentation itself. Now we're going to open it up for questions or discussion for anybody that has a question. And just a reminder, we left the directions up there on how you can ask a question. Just go ahead and hit that hand sign on your toolbar. You can also type a question in, but we love to have people ask questions directly. So do we have anybody that is waiting to ask one directly? No. Okay, so we have Linda Brown asked, what does incurred cost mean?
Incurred cost.
Mm-hmm. Probably a further, when we were talking about it, you were talking about incurred costs.
Oh, regarding the slide on Alaska or the national data?
Do you know what, maybe she's asking what all is included in incurred costs?
For CDSMP it's about $300, and what they mean for that is just the cost in terms of holding the class, renting the space, having the information available for the people. We do actually, the state of Alaska, what we do is we provide all of the books necessary for references. The printouts would be where most of the cost would come from, in the $300 and the space rented, and also the snacks that they provide every now and then, depending on the timing of the class.
Linda, let us know if that didn't answer your question. There was a... Oops. Okay, we'll go ahead and unmute for Raylene had a question. Go ahead and talk, Raylene. I'm sorry, it's Raylene. One more time. We're having some technical difficulty. It's not letting us unmute you.
Okay. Well,
oh, you typed one in. All right. I completed the CDSMP facilitator course in early 2009, but Fairbanks Resource Agency was never able to get more than 3 to 4 individuals to come. Is the 10-person requirement necessary, and do other places have trouble getting people to come?
Yes, the 10-person requirement is necessary in order to show fidelity. I think the minimum that we have allowed in the past is about 9. And yes, there's other people that have that difficulty. And I have actually gone through the process myself to see how difficult it is. I did get the training, and my task was actually to focus on a particular group, and that was the Spanish speakers. And one of the things that we were discussing not too long ago was the main problem is advertising. You have to make sure to create really, really strong ways to advertise, not just posting it via making it available, but actually making some contacts with the community, with some community leaders who will actually act as ambassadors for your program in a way. That would be one. The other thing is anybody who's done a class in the past, if you could get, usually there are surveys that they complete, and if you can get those testimonials and actually put them available on your organization's website, that's another thing that works really well. The other thing that we are doing right now is we're working on our Living Well Alaska website. We are bumping it up, revamping it, and putting a lot of information like the cost estimator tool, a lot more evidence-based, making it a lot more user-friendly for people to sign on. There were some comments regarding that the text wasn't large enough and some of the text was confusing. and the information didn't just pop for people. So we're definitely working on that, and that's why we're getting more pictures and such to make it more fun for people. The other thing too is that partnerships are really important. One of the things that we really welcome is, for example, if you're in Fairbanks, then to make that information known to places like hospitals, like Fairbanks Banner Health, or the federally qualified health centers in Fairbanks, so that way they'll know about your program and they can send or refer people to your program. And there's one thing about saying that, but it works so much better if you actually meet with somebody in the leadership where there's some type of strong referral process inside, by either meeting with somebody who's an administrator and letting them know that that's information or some type of agreement between two organizations. The other thing, social media, posting on Facebook, tweeting about it, taking pictures, making sure people know that it's free, when it's going to take place, what time, all that type of information is really important. And there's this belief that maybe older folks are not necessarily on Facebook, or they're not really looking at the media. That's not entirely all true. From what we found so far, with at least my experience, it seems like they do encourage, or they do get on Facebook often, or some, and they do receive information via social media as well.
Great, thanks, Nellie. There was I'm going to answer a couple of things really quick. There was a question on whether we're going to send the slides out so people can hit all the links and everything. That will be sent out. It's within a week. Anybody that attended today will get a follow-up email saying, or showing you where you can download that and get a recording of today's conversation as well. Somebody asked that we put the slide back up of the trainer, how to become a trainer.
Maybe on the resources slide.
Is it on the resources slide? Okay, maybe we can just click on that as we're answering more questions. I believe we had somebody that wanted to ask a question by...
Oh, wait.
Uh-oh. Hang with us, people.
Good.
Okay. I'm going to go, while she's working on that, I'll ask this next question, well, I'm going to need your help with this. Looks like Nancy had a question. Let's go ahead and unmute her. Nancy, go ahead and ask a question.
Oh.
Are you there?
Nancy Hardman.
Can you hear me?
Yeah. Go ahead with your...
Oh, good. I was having some issues trying to figure out the buttons here. So I was curious about when the next CDSMP training program is, and when the next DSMP training program is.
So the next DSME training is going to be February 29th to March 3rd. It's 4 days, 8 a.m. to about 4:30 p.m. And they will take place at Anchorage at the UAF Cooperative Extension Services. For more information about that, you can contact Leslie Shawcross. Her number and email are on, you should be able to view it right now. We do make CNEs available. We estimate approximately 24.5 CNEs to be available for this training. In regards to the next CDSMP training, the last one we had in September of 2015, and we trained 15 people, and we're still discussing the idea of making that annually. That will depend on our budget, as well as how many people are interested in receiving the training. Because in order to make sure that a training does take place, we need to have at least over 12 people interested in it. So that's another thing that we're thinking about. But possibly September of this year, like we did last year, but we're still discussing that idea.
I think we are almost out of time, Nellie. We're going to ask one more question. Thank you, everybody, for your great questions. We might be able to find a way to capture these and send emails to people that sent their questions. If we don't get to your question, we didn't. If you could put it in the evaluation afterwards, I'm sure Nellie or I can help follow up on those. I'm going to ask one final quick one, because I think it'll be easy to answer. Does the training include discussion for recommendation for recommended cancer screenings?
No, unfortunately, the trainings are very specific and limited. There's a very strong fidelity of them. They're kind of not necessarily verbatim of what you have to say from the sheet, but you have to stick to what the topics state on the sheet in order to make sure they stay at the high quality. They're not that different from any of the other trainings in any of the other locations. And at this time, we don't share information regarding cancer screenings. However, that being said, we can always, if somebody were to ask a question about it, then the question would come to our office, and then we would email the class as a whole. But that does not mean it would get discussed within the leader training.
Great. I think that's all we have time for today. Thank you again, everybody, for attending. Great participation, and thank you, Nellie, for the really interesting topic.
Thank you.
Remember to tune in next month, third Tuesday at 1 p.m. Well, and you should be getting an email soon with a link to the PowerPoint for this. Thanks again.